Alaska's healthcare landscape is vast and diverse. From Anchorage to remote villages, Alaskans depend on a coordinated healthcare system to receive timely, accurate care. But what happens when medical information can't easily flow between providers? That's when healthEconnect Alaska's Health Information Exchange, or HIE, comes in, connecting healthcare providers and supporting better outcomes for all Alaskans. To illustrate the value of the HIE, let's explore the stories of 4 Alaskans navigating different challenges within the healthcare system: Wasili, Elena, Alex, and James. These stories show how the HIE bridges gaps in care, improves efficiency, and transforms healthcare delivery across the state. Meet Wasili, located in a village near Bethel. One chilly afternoon, he suddenly gets dizzy, collapses, and becomes disoriented, unable to speak clearly. His family rushes him to the emergency room. Once there, the ER doctor learns that Wasili had a previous stroke, but his family isn't sure how recently or if he's still on blood thinners. This is critical information needed to safely give him life-saving clot buster medication before time runs out.
We routinely hear about hospitals and clinics receiving phone calls that are like, hey, we have a patient here who's also under your care and we need their records. It's just crazy that in 2025, we still rely so heavily on phone calls and fax machines, which are time-consuming and inefficient to exchange essential information. This reliance can hinder providers' ability to help patients effectively, cost-efficiently, and with the quality of care they deserve.
healthEconnect Alaska's HIE securely connects the electronic medical records, or EMRs, of clinics, hospitals, behavioral health facilities, specialists, and more, enabling providers to access comprehensive patient records through an online portal or directly within their EMR. The HIE delivers critical clinical data, including lab results, medication lists, encounter history, and care summaries, supporting providers with the information they need to improve care coordination and decision-making. Thanks to the HIE, Wasili's healthcare team is able to quickly access his medical history, including records from his primary care provider and various specialists. With this secure, real-time access to his recent medications and treatment notes, they confirmed it was safe to administer the clot-busting medication he urgently needed.
As a healthcare provider, I need accurate and up-to-date information from a wide variety of sources that do not communicate with one another. That is why I'm continually impressed by the power of the HIE, the Health Information Exchange. The wealth of data available, from medication history to specialist notes to imaging studies, empowers us to respond quickly and accurately, especially in urgent situations. The HIE enhances the quality of care and reduces cost of care that we are making by ensuring timely, informed, and effective decision-making.
Meet Elena, a medical assistant at a busy clinic in Juneau. One morning, Elena is juggling multiple tasks, checking in patients, taking vitals, and trying to track down records for a patient's upcoming appointment. The patient, recently discharged from a hospital across town, needs follow-up care, but the discharge summary and medication list haven't arrived. Usually, Elena would pick up the phone, joining many medical assistants and front desk staff across Alaska who spend hours chasing down patient records. But today, Elena takes a different approach. She logs into the secure HIE portal instead of relying on phone calls, faxes, or voicemails. Over the past few years, Alaska's HIE has steadily expanded, connecting more healthcare providers across the state. With increased participation and more data being shared, it's helping improve the way care is delivered in Alaska.
In healthcare, there's no substitute for working as a team, which requires having the right data. Our Physician Collaborative knows that the more we are able to integrate the Health Information Exchange into our practice, the more we will be able to use that data to benefit all Alaskans. That's why we support the HIE. Its strength depends on providers actively contributing and using data in their everyday practice. That doesn't just help our patients today, but it also builds a stronger healthcare system for Alaska.
Thanks to the active participants within healthEconnect Alaska's HIE network, it takes Elena just a matter of minutes to pull up her patient's discharge summary, medication list, recent lab results, and care notes. By the time the patient's appointment begins, Elena and the care team have everything they need to make informed decisions.
As someone who trains medical assistants across Alaska, I understand how demanding their jobs are and how vital it is to reduce unnecessary stress. The HIE is a powerful tool that makes their work more efficient by providing quick access to the information they need, eliminating the time and frustration of chasing it down. This allows them to focus on what truly matters, delivering the best patient care.
Meet Alex, navigating life in Anchorage without consistent housing or access to healthy food. Recently, Alex was hospitalized for a respiratory illness. Despite treatment, her recovery has been slow, made harder by her living conditions, and she has not fully recovered since being discharged. One day, Alex receives a call from a care coordinator. As part of a special initiative aimed at addressing social determinants of health, Alex's primary care clinic has used the HIE's Population Explorer tool to identify individuals with health-related social needs, including food and housing insecurity. Through this special outreach, Alex is now matched with local resources to address the root causes of her health challenges, helping her fully recover and avoid repeat trips to the hospital.
Stories like these highlight the incredible impact of using tools like the HIE's Population Explorer. It's not just about treating a medical issue. It's about addressing the social determinants of health and understanding the whole person. By connecting individuals to resources like food and housing, care teams can support the full recovery and help prevent costly ER visits. This is just one of many ways that the HIE contributes to cost savings.
Meet James, a busy professional who frequently travels across Alaska for work. Over the past few months, James visited several emergency rooms with symptoms such as a racing heart and chest discomfort. Each visit was treated as an isolated incident, with no single provider seeing the full picture due to his care being spread across multiple facilities. Thanks to the HIE and its event notification system, James's primary care provider is alerted to his previous ER visits and recognizes a pattern. They follow up with James and are able to connect the dots between his symptoms and anxiety, adjusting his treatment plan to include better management strategies. With more coordinated care, James is able to reduce his emergency visits and better manage his anxiety, improving both his health and his quality of life.
The HIE has truly transformed how we deliver care. Whether you're part of a large hospital system or a small clinic, the access to comprehensive patient data gives everyone the tools they need to provide the best care possible. It bridges the gaps between providers, levels the playing field regardless of an organization's size, and ensures equitable, high-quality care for every patient, no matter where they're treated.
While the names and faces in these stories are fictitious, they represent real-life scenarios that healthcare providers across the state encounter daily. Thanks to the HIE, healthcare providers like Elena can deliver more efficient, high-quality, and cost-effective care to Alaskans like Wassily, Alex, and James. The HIE ensures every provider has access to the same essential patient data, and every patient receives quality, equitable care.